Yeah, we are live.
Right. Hi everyone, I'm Bharati from Careers 360 and with me is my colleague Gauri Rane. Gauri and I both welcome you all to this webinar on careers in healthcare beyond MBBS. So we know that a large number of students, they aim to join the healthcare sector. But the challenge often arises when they're not able to think of more options beyond MBBS and beyond becoming a doctor. While in reality, the healthcare sector has multiple other lucrative career opportunities to offer. And this webinar will throw light on all of those. We have with us our speaker for today, Dr. Vishal Kumar Gupta, Deputy Director Academics, JSS Academy of Higher Education and Research, Mysuru. Hi, sir. We welcome you. Thank you so much for joining us today.
Thank you, Varidhi.
A little more about Dr. Vishal before I request him to take over. So, with a doctorate in pharmacy, Dr. Vishal Kumar Gupta is Deputy Director Academics at JSS Academy of Higher Education and Research, Mysuru. He coordinates the internationalization and collaborative efforts at the institution. In his more than 18 years of teaching, research, and administrative experience, he has published more than 140 scientific papers in peer-reviewed national and international journals and has published a book. He is Executive Editor, Journal of Asian Association of Schools of Pharmacy, the official publication of Association of Schools of Pharmacy since 2015. Once again, we welcome you, Dr. Vishal, and thank you for joining us today. With this, I would request you to take over and take us through your presentation. Post that, we'll throw open the floor for questions and answers.
Thank you, Varidhi, for the introduction, and heartily welcome my dear student friends for today's talk on careers in healthcare beyond MBBS. As rightly pointed out by Varidhi, it's very challenging. Every parent has an ambition that his or her ward should become a doctor. Basically, that's the first ambition. But if they're not able to get through, what are the other options apart from getting it through NEET? What are the other options which are available? I would like just to throw a light on those aspects. So I heartily welcome you all. I am Dr. Vishal Gupta, Deputy Director at JSS Academy of Higher Education Research, Mysuru, the top second university in India as per the Times Higher Education rankings. So this is a talk which we'll be having today. It is careers in healthcare beyond MBBS. My overall agenda of this discussion with you would be what is this career in healthcare? What is the basic things which has happened in healthcare, how it has diversified itself, and basically in the healthcare, what you can talk about the biomedical and allied health science and pharmacy opportunities, the life science programs and the health system management programs. And briefly, I'd also like to introduce you to my university, where we are believing in transforming of the education, that is JSS Academy of Higher Education Research, Mysuru. Now, introduction to healthcare. Now, when we link or think about the health, the only thing comes to us is the doctor community. But health is defining the future of the individual, the community, the nation, as well as the world. And healthcare management is becoming much sought after specialization nowadays. It is one of the most important industries, and it sees professionals from across disciplines. Healthcare has very, very broad range. It is not just treating the patients, doing surgeries and other things. It involves direct patient care to administration, marketing, managerial skills, education, as well as research. And employment in the healthcare occupations is projected to grow at 15-20% over the next 10 years, much faster than the average of all the other occupations. And this growth is mainly due to increased awareness, longer lifespan, and growing demand for healthcare services. Everybody, whatever the amount they would be earning, they want to be healthy. And we all know that since childhood, health is wealth. Now, why you should pursue your career in healthcare? Now, this is an expanding industry, and there are always positive job growth trends. The industry is nation, but it's not focused to one area or the two area, only some pockets of the country, some pockets of the globe. You'll get this. It is there across the globe, across the country. And healthcare professions can be meaningful and personally very rewarding. You'll feel very satisfied when you are able to help a person achieve a better health outcome. The benefits are high and they're rising in proportion to other industry sectors. The medical advancements are constant learning process with constant challenges. And there is huge opportunity for career advancement. And it is you're able to enter this sector at almost any education level, right from the diploma, your undergraduate, postgraduate, any level you are there, you can get into this industry. It is frequently flexible hours and work environments, and you are able to work in variety of settings. You're not just fixed up in some industry or some in office. You can work in hospitals, nursing homes, medical offices, pharma industry, critical care clinics, assisted home health care facilities, clinics, research and diagnostic laboratories. Apart from the physician, whom we call it as doctors, what are some of the highest paid non-physician jobs in healthcare across the globe? One of the foremost is a pharmacist. Then you have clinical embryologist, you have respiratory care technologist, dietitian, nutritionist, radiological and MRI technicians, diagnostic medical sonographers, cardiovascular technologists, orthotic and prosthetic professionals, occupational health and safety specialists and technicians, dental technicians, laboratory technologists, speech language pathologists, genetic counselor, radiation therapist, occupational therapist, medical and healthcare services manager, physician assistant, nurses, and public health officer. So as you can see, you'll be surprised that so many different, these are only a very few of the jobs which are taken here. You should remember that the past decade marked a downturn in employment in many of the industries, but healthcare was not among them. So with this brief introduction of healthcare, I would like to just tell you about what are the different programs which are available for biomedical or allied health science programs. When you talk about the biomedical programs, you have, or many universities, they call it as allied health, because that is a part of the healthcare system only. You have various programs like medical lab technology, medical imaging technology, renal dialysis technology, medical respiratory care technology, operation theater and anesthesia technology, cardiac care technology, perfusion technology, emergency medicine technology, optometry, physician assistant, medical genetics, forensic sciences, Bachelor of Occupational Therapy, and other programs. The fees varies from 1 lakh to 3.5 lakhs on an average. And basically, if you have a +2 degree with a pass in PCM or PCB subjects, you're able to join for these programs. This program, remember my friends, many of the universities offer it at 3 years, but you want to pursue your career across the globe, it is very important that you have a 4-year program. And as per the NEP regulations also, 4-year has become mandatory. So that's why be very careful in choosing the course. Then you have the master's degree in medical and biomedical sciences. You can pursue your career in medical microbiology, medical biochemistry, medical physiology, medical anatomy, medical pharmacology, clinical embryology, clinical psychology, echocardiography, and medical genetics and genomics, masters in public health. Then there are some master in philosophy programs also, psychiatric social work, clinical psychology. So these courses are also high demand. And in fact, in our university, one of the high demand programs is clinical embryology, where the tuition fee is close to 7 lakh rupees per annum. And students are earning well also when they are employed. That's why they are able to afford and pay it. So what happens when you do these programs? Might be your next question. See, you work in close association with the doctors in supporting the patients for better healthcare outcomes. You can become an occupational therapist, you will become a cardiac care technologist, you will become a medical imaging technologist, a respiratory care technologist, optometrist, forensic scientist, medical lab technologist, and renal dialysis technician. So next set of programs which I'd like to highlight, and as I told you, this is one of the highest paid across the globe, is pharmacy programs. There are different levels of the pharmacy programs. You have the diploma level, where the D-Pharm program, what we call. Then you have bachelor's program, that is Bachelor of Pharmacy, a normal Bachelor of Pharmacy, which is of 4 years. Or you have the lateral entry also, where you can do it in 3 years. Okay, and you have the Doctor of Pharmacy program. This is a new program which is envisaging in India. And in JSS, it is ACP certified, means it is accredited by American Council for Pharmacy Education. So what happens? The quality of education, whatever we offer, is on par with the global standards. Then you have the PharmD post-baccalaureate degree, B.Pharm practice degree. Then once you're done your undergraduate degree, you can also pursue in the master's program, like pharmaceutics, where you make the drugs. Some will have fascination. When I interact with the school kids, what you want to become? They said, sir, I want to discover vaccine. I want to do a new type of dosage form. I want to prepare painless injections. So many ambitions they have. And to make this, these are the programs which you have to study. That is pharmaceutics, where it involves making all your tablet, capsule, syrups, how you make it. Industrial pharmacy, how formula which you have, it can be extrapolated to the industry. Pharmacy practice is a concept where you are involved in the direct patient care. Then pharmacology is study. Any drug, it has to come into the market. It has to first get tested in the animals. So study on the animal studies is called as pharmacology. Then you have the chemistry, where you have fascination. I'll discover new this molecule, that molecule. So all the chemical reactions, you tend to change it and make it. That is what is pharmaceutical chemistry. Analysis is testing of it. Quality assurance, regulatory affairs, pharmacognosy, and biotechnology. So career prospects are, you can become a hospital pharmacist where you work in a hospital. You can become a clinical pharmacist. Then you want to become, you can become a community pharmacist. You can become an academician. You can become a research scientist, drug regulatory officer, clinical research associate, pharma marketing, drug formulation scientist, as well as quality manager. Then I'll show you or want to tell you about life sciences programs also. Now, life sciences is a program where some people who have ambition to do the pure sciences, which we call it as life sciences or natural sciences or just sciences as such. So at our university, we offer these streams: microbiology, biotechnology, environmental science, food nutrition, dietetics, and psychology. So pass in second piece is sufficient for this. And in fact, for the food nutrition and dietetics, we are seeing a huge demand from the, especially the feminine gender, to undergo that program. So once you pursue your UG degree, you can also pursue your dreams in your post graduation in environmental science, geoinformatics, microbiology, biochemistry, nanoscience and technology, nutrition and dietetics, cognitive neuroscience, cosmetic science, molecular biology, bioinformatics, biotechnology, medical statistics, sports nutrition and management, as well as medical physics. Your careers, you can become a dietitian. Now, the whole world is obsessed, I could say, with having a healthy diet. So for that, you can become a dietitian or a nutritionist. It's going to see a huge boom. And we are seeing lots of groups are formed, lots of apps also have come where they are working on it. You can become a microbiologist, environmental scientist, nanotech scientist, medical statistician, bioinformatics analyst, as well as cosmetic scientist. Next is health system management studies. Now, this is a program where you manage the healthcare. So it's not your regular BBA and MBA programs, what you do, financial management, human resource management, and other aspects. But it's a new concept in healthcare which has come, and JSS is one of the few universities which is offering a program in this. You have the BBA program in hospital and health system management. Same manner, you have MBA in hospital administration, MBA in pharmacy administration. Career, you can become a healthcare consultant, you can become a hospital. See, all the doctors have to be taken care of. So you can become a hospital administrator, you can become a health product manager, you can become a pharmaceutical product manager, product marketing, medical practice manager, data analytics manager, health informatics manager, health finance manager, and blood bank administrator. As you can see, just by 2 or 3 programs, we have so many career opportunities in these areas. So with this, some of the, because other things, speech and hearing, nursing, and other things you would have heard, dentistry and other things. So that's why I thought, let me focus on other programs which you will not know. So briefly, with the time available, I would like to tell you something about our university, which believes in advancing education and creating new knowledge by transforming knowledge to impact. So I bring greetings. We are located in the beautiful city of Mysuru, which is the cultural capital of India. And we have vision to provide education to help in transformation of individuals and society. And our mission is to expand the boundaries of education and to make the most amazing learning possible. We were established in 2008. We are UC recognized category 1 university. We are health science focused, research driven university. So we have started our journey with 4 constituent colleges. We have under our ambit Medical College, Dental College, JS College of Pharmacy, Mysuru, and JS College of Pharmacy, Ooty. Apart from that, we have 3 schools: School of Public Health, School of Life Sciences at Mysuru, and one at Ooty. We have 7 university departments: water and health, health system management, nutrition, yoga, microbiology, environmental science, and bioinformatics and biotechnology. And we offer close to 154 programs. This is in nutshell what we have. We have published in the 10 years close to 10,000 publications. We are a team of 1,000 faculty. More than 6,000 students are studying with us. We have 900 researchers, and we offer 150 programs. And all our teaching learning is happening through JSS Hospital, Mysuru, which is a 1,800 bed hospital with 55 special clinics, 37 specialties, NABH accredited, and also having 600 oxygenated beds and 160 plus ICU beds. Coming to ranking and accreditations globally, I will highlight very few. As you can see, the whole slide is filled up with so many rankings and international ratings what we have got. The most prominent is in the world. We are ranked in the band of 351 to 400, and in India, we are second. In the subject of clinical health, we are first in India. In the young university also, we are first in India. The National Institute Ranking Framework, which ranks our universities and constituent colleges, we are ranked 34th. Our medical college also ranked 34th. Dental is 12th, and two pharmacy colleges are 6th and 8th. So to support our teaching learning, we have very high advanced skill and simulation lab, which is one of the best in Asia itself. We invested close to 25 crores in this. And we also have a virtual reality based robot assisted learning process to happen. So this is our leadership at the university with the executive secretary. Then we have the pro chancellor, Dr. B. Suresh, who himself was an eminent pharmacist. Then Dr. Surinder Singh, who was formerly the Drugs Control General of India. Then Dr. Manjunath, who is a registrar. Then we are supported by a light team of members, Justice Shivraj Patil. Then we have from Harvard Medical School, Dr. Gyangi Sabo. Then we have Padma Shri Dr. Professor Randeep Guleria ji, who is the director AIMS, also in our board. Then Padma Shri Professor Yogesh Chawla, who is the former director of PGI Chandigarh, he is also with us. Then Padma Bhushan Dr. Krishna Ella, whom you will be very well knowing as the Covaxin man of India. So he is also part of our team. So globally, we are spread across the whole globe, as you can see. Different universities we have collaborated, a lot of outcomes we achieved, and we have top companies, Fortune 500 companies come visiting us and hiring our students. So in the past 5 years, more than 170 plus recruiters have visited our company. These are some of the snapshots of the facilities at JSS HER. I'll just show you research facilities. You want to pursue your research dreams. And this is the other zebrafish research facility, the other sophisticated equipments. We have equipments close to 50 crores with us. Students performing and doing their this one. Then this is the classrooms what we have, academic facilities, lively interaction happening, closed group discussion, training which is happening to the students. As you can see, the library, literature resources, advanced labs and animal house facility. These are pictures of some of our labs. State-of-the-art infrastructure we have. We are very proud to say we are a clean and green campus. And every year we end up winning some or other award for it. Then it is a clean and green campus also. We are state-of-the-art sports and recreation facility. As you can see, students are enjoying playing the sports. We are coming out with a global campus at Varuna, where we are investing close to 2,000 crore rupees to set up a world-class global campus. The foundation stone for the same was laid down by the former President of India, Ramnath Kovind ji. So if you have any doubts, you can mail to us on admissions@jssuni.edu.in, or you can call us on my number 92421-57508. So this is the strength behind all our achievements, and thank you everyone for your patient hearing.
Yeah. Vandita, am I audible?
Yes, you're audible.
Thank you so much, Vishal sir, for such a nice presentation. So students, if you have any questions you want to ask Vishal sir, please use the reaction button to raise your hand and we will give you a chance to unmute and ask. Till then, Vishal sir, we have got a few questions in the chat box, which I would like to put forward to you.
Yeah.
One of the students wants to know what would exactly be the difference between paramedical courses and allied health courses? And out of the career options that we've just discussed, or the courses that we've just discussed, which of those would fall under each of the categories?
Paramedical and
Health sciences.
Huh? Could you be more clear, Varidhi? I just lost your word for the second.
Is there a difference between paramedical courses and allied health courses?
No, see, the terminologies used are quite, it's one and the same. You have the paramedical, biomedical, as well as allied health. All of them come under the single basket. What happens? What has happened actually is for these courses, there are no regulations as set up by the government of India. Now, what has happened? The UGC has come up with a new notification, and they have set up an act of the allied health science courses. So all these programs which I was discussing with you all of them will be coming. So it is a terminology in some states where they feel the students are more confident of using these terminologies, they have started using it. That is what it is happening.
So one of the students wants to know a little more about nursing as a profession. So can you just give us some insight on this. What are the kind of courses one would need to pursue after class 12, and what does the career look like?
So nursing is a very good career option. As you know, there is a breadth of nurses which is happening. There is a huge shortage. But what has happened? Many universities have started the nursing programs with churning out a lot of nurses. So one thing you should remember that nursing courses, whatever you do, always do a bachelor's program. Always do B.Sc nursing, and especially after doing your plus 12, the better is to go for honors nursing now. If you have career ambitions, you want to pursue outside India, many of the top developed nations, they have only or recognizing only B.Sc honors nursing, which is an additional nursing program what you try to do. So be very careful in choosing the university. In fact, in our sister concern, we offer the nursing program. So you can do the nursing program in that. And apart from that, you also have certificate and diploma programs also for the nursing, A&M, GNM, ophthalmic care management, home care nursing, trauma care technician, diploma in nursing. But these are only for limited scope. So always do a B.Sc nursing program. And there was a trend where we felt that only the feminine gender would be able to do the nursing program. But what trends we are seeing from the past 5 years is a lot of the male gender are also doing the nursing program.
Okay, okay, sir. We have a hand up. Dipalita, can we unmute Sabir Hussain?
Hi, good evening. Thanks for the session. I'm having one query here. Nowadays, there is Pharma D is there.
PharmD, yes, sir.
Which is for 6 years.
Yes,
Just
sir.
I want to understand if the student completes that Pharma D course, Pharm D,
Yes,
so he can able to do practice like a MBBS doctor or a MD doctor like that. And is it equivalent to MD or MBBS, sir?
Sir, I'll just clarify the doubts, Shabir sir. Thank you for the query. Now, PharmD, as per UGC notification, it's a postgraduate degree. It's not an undergraduate degree. It's
Okay.
a postgraduate degree, for your information, because it's a 6-year program. And the persons who pass out are called as Doctor of Pharmacy. Now, the word doctor is a big challenge here, because in our Indian tradition, anybody by the name of doctor is addressed as, they are taken into medical community. But the role of a Doctor of Pharmacy candidates is completely different. He is a clinical pharmacist by nature. See, whenever doctor treats a patient, his job is majorly to diagnose the disease. He will look into it and find out what is the disease, and then he will prescribe the medications. Now, what the developed world has moved into, they have found that the doctors are preoccupied, and they need a little more support in especially giving correct dosage regimen, because of the awareness which is happening among the program. So to fill that gap, the doctor diagnoses and the pharmacist prescribes. This is the basic concept with which the Doctor of Pharmacy program is being implemented. See, where a patient is there, here a nurse is doing multiple roles, right, sir? A nurse looks after it. Nurse only looks after the medication. Nurse only gives the tablet. Nurse only gives the IV injections or whatever it is there. The whole thing setup is looked after nurses, and they are overburdened. But in the when you talk about in the developed nations, the pharmacists are empowered to do this, including immunization. So they cannot do the practice, for your question, sir. They cannot do the practice as a medical practitioner, but they can support a medical practitioner in the correct delivery of the drug, the dosage form, as well as the dose, and monitor the patient. Whether the doctor has given the drug, prescribe the tablets, whether it is being given, whether the effects are being shown, any adverse reactions are there, any side effects are there. All that monitoring will be done by the Doctor of Pharmacy, who are majorly employed as clinical pharmacists.
Okay. Now, why I'm asking,
Yes, sir.
I came across a couple of people, I can say 2 to 3 people who did their PharmD. The two, they are working as a duty doctor in corporate hospitals. So that is the reason query came to my mind.
No, sir. I don't think so. It's right. I'm also a pharmacist, but I don't think so. It's right.
I understand. That's the reason whether is it
See,
really
clinically, they study the subject in depth, very, very deeply, on par with the MBBS, especially the pharmacology front and the drug reaction. In fact, an MBBS graduate will also not be ready reading so much. So it's a coordination, because we offer this program at our institution. We are one of the pioneers in offering it. So that is what is the thing, sir. The clear-cut guidelines. There is a practice regulations brought about by the Pharmacy Council of India, which is very clearly telling the roles and responsibilities which has to be done.
Okay, okay. Fine. I'm having one more question, but I don't know is it the right forum to ask or nowadays, if you see people are going to foreign countries to do their medicine, and once they come back again, they have to write the clear the exam conducted
Yes,
by Medical Council of India. Earlier, now it's I think National Medical Council is there.
Yes,
So
sir.
how far it is when compared to our Indian medicine medical courses? I'm extremely
Sir,
sorry to ask this question.
No problem, Shabir sir. See, students also should remember this. Every country has its own standards for education.
Okay.
Now, if you pass any degree from India, you want to work in a developed nations like US or anything, you will have to give their examination.
Okay.
So if I do here, I want to work in any other country. If that country has a system of recognizing any foreign degree only through entrance examination, we'll have to give it. That is just to ascertain that the level of training, whatever has happened, is corrected on par. Because why this is very important is because we are treating or we are looking into the health of the patient. Health is very, very important. Any challenge comes through, it will be a big problem for us. Right, sir? That's why, especially for these health programs, every country has an exit exam or exam system as such. India also has it. Other countries also have it.
Oh.
Okay. So she wants to know which of these fields has a brighter future as per you. So biotechnology, BDS, or physiotherapy?
See, all three different domains are different. See, it's not about the scope. See, scope is there in every program. Now, when you want to pursue your dreams in dentistry, oral health is one of the neglected areas in India. We go to a dentist, including me, I could say, we go only when there is a problem, right? When we are critical, when we have a problem, or some deformities have happened in the teeth, something you want to go, then only we are able to go through it. Now, the challenge here in the health is creating an awareness. So when you create an awareness amongst the people that it is very important to monitor health every 6 months once, then automatically the job opportunities for the dentist will increase. So that is what is one area, the dentistry is there. Number two was your biotechnology. Biotechnology is a field where you want to pursue your research ambitions and bring out some new products like vaccines and other things, which is your core area or your interest. Then you should work in a biotech industry. And biotech industry is growing leaps and bounds, and definitely there are very good career opportunities. Physiotherapy, when you talk about, again, it is based on the only the patient care. And that too, when in the orthopedic, the scope is not, I'll say, limited, but what happens, the persons, people availing the services are limited. So that's why whatever course you do, you always, my request to you, my friends, is do from a top reputed university. When you do from a top reputed university, you will be recognized for your skills and you will learn all the skills and you will be able to get a very good employment.
All right. So the next question is from Adarsh, and he wants to know if I pursue my bachelor's in biomedical sciences, what are the kind of job roles I can look at in the future?
See, when you pursue your dreams in biomedical sciences, I showed you around 10 to 12 different roles. Now, what are those roles? I will just tell you. When you work in an hospital, Okay, doctor is there. Now, doctor different. There is a neurologist, there is urologist, there is a cardiologist, there is a respiratory head, a surgery head. All these people are now utilizing very high-end equipments. Correct? You do your CT scanning, you do your MRI scanning, you do robotic surgeries. In respiratory care, you have different various types of machines. For urologists, you have the dialysis machines. So doctors, equivalent to doctor person is not available to monitor it correctly and decipher the outcomes very, very clearly. So to fill this gap only, we have the biomedical programs. And the job opportunities are very good. See, I was showing you the fee structure in our university. The biomedical programs are in very, very huge demand. We have very limited courses, 10 to 15 seats per course, and the applications easily cross more than 100. So that means the people are genuinely interested, and we have started a new program in genetics, because we understood in the next 5 years, genetics is going to play a very, very important role in the healthcare. So there also huge demand is there. Next year, again, we are starting artificial intelligence in healthcare, because we realize that there will be acute shortage. The people are moving in from the human inference to the machine inference of many of the things. So we are developing those programs. So like this, different roles are being evolved in the biomedical sciences program, and definitely the growth opportunities are very, very good.
Okay, okay, sir. So on these lines only, sir, there are quite a few students who assume that engineering or anything that is more technical in nature is not related such to healthcare, while in reality, the instruments and the machineries that are used in hospitals are based. Could you just throw light on some of the careers in this context? I mean, what are those careers which see an intersection of technology and medicine?
Yeah. Thank you, Viridi. Now, dear students, you have to remember, there is no one single program which you will be learning through. With the advent of the NEP, it will be interdisciplinary approach of the different programs which is going to happen. Okay, so there will be blend of engineering, technology, healthcare delivery, and all the other aspects, including economics, your humanities, everything is going to get intermixed. Now, when you see in the hospitals, you are fascinated by seeing huge equipments which are running. Who has developed those? Those are developed by the engineers only. But how engineers are able to develop? For developing those, they would require inputs from the doctors and the healthcare professional team. Like example, in our university, we are working with 4 or 5 multinational companies who are bringing in new devices, and how they are developing is based on our input, what the patient will look for, how it should be there, how the fast the results should come, and all those aspects. So the careers, that's why I told you we are bringing out a course in AI in healthcare, where artificial intelligence will play a role, how it is going to play, and in healthcare. So your respiratory care technology and all, you'll be not actually developing those systems, but you'll be learning how to use these systems and decipher the results which are going to come into these systems.
Okay, sir. So something about, so students who direly want to pursue MBBS, and if they don't get a chance in India, they choose to go to other countries, be it Russia or Ukraine or China. The challenges they face if they eventually have to practice in.
Variti, your voice is getting very highly disconnected. If you could be nearer to the mic and continue to speak.
Is it better?
No, unfortunately, no.
1 second, please. 1 second.
I think you have plugged in your earphone and that's causing the problem. Yeah, Variti, could you repeat your question? I request the team from Career 360 to unmute her.
Yeah, Varidhi, you're not audible.
If you could understand her question, what she was trying to convey is, people, if they don't get in their MBBS programs here and they directly go and do their exams in other countries, first of all, you should ascertain that MCI, that is the Medical Council of India, which has now become the National Medical Commission, has a list on its websites showing the approved universities from where you can do the MBBS program. So it should be MCI or the NMC recognized. So if you want to pursue outside India, please ascertain that it is first NMC or MCI recognized, because even if you complete and you want to work in India, those, if you don't have the MCI or the NMC approval, you will not be able to do anything about it. And as I told you before, once you do the test, you will have to give the examination so that your degree will get recognized. So these two things you please remember, do a thorough search, and be very careful about the websites. Because when I checked the websites, in fact, when I wanted to survey one of the universities, I found that the two similar websites are existing, but with slight changes in their addresses. So you have to be very careful which website you are going to check and get the information.
Dr. Vishal, just give a second.
Yeah.
Okay, because I think Bharati is facing some technical issues. Till then, we'll carry on. There is one question by a student where they're asking, can I get into healthcare management if I don't have a PCB background?
Yeah, definitely. Because once I showed you in my slides very clearly, healthcare management, it's a BB and MBA. The eligibility is different. We don't need any PCB background.
And what are the kind of careers that these students can take up?
No. These guys become hospital administrators, marketing managers. I have seen many of them earning handsomely in the life insurance sector, because with the knowledge of the health sector, basically these MBA graduates or other people who are coming, we don't have any idea of the healthcare, coming down here and working. So what happens instead of that? If you are able to go into this program with the idea of the healthcare, because ultimately you are selling health and your healthcare only to your clients. You become hospital administrators, and in the hospital, many departments are there: marketing head, product management team. So huge career opportunities are existing down there.
And is there any other qualification, or is there any other aptitude that will be required for students to take up this? Because when we talk about healthcare, other than the qualification, there is a different aptitude that students generally look at.
Yeah.
So is there something like that for these kind of students as well, who get into hospital administration and all those kind of job profiles?
Gauri, what I would like to tell you is, we have built these components within the curriculum. See, we can't get any candidates ready-made having prior knowledge and about this. So we have in our curriculum what is healthcare, how is hospital administration, what is the health sector, what is medical tourism, and all those aspects, along with the soft skills development also. So when you train up these students in the soft skill development, automatically what are the queries you raised about the aptitude and other things will be answered. And they are made to work live with the doctors and on the floor. It's not classroom teaching. Only 1 year classroom teaching happen, and then the experiential learning will happen.
Okay, it's more hands-on and practical.
Hands-on and practical.
So there is another student who has asked, Aditya wants to know that, is there any difference between a dietitian and a nutritionist, or are they the same?
No, there is a very minute difference, not much. See, one person controls your diet, especially to see to it that you take very low calories and you get your adequate proteins. Simple terms, I'll tell you. But nutrition looks at a very bigger picture, that you get all the sufficient nutrients, your amino acids, your vitamins, and all the other things. But now both are intermixed, actually. Both of them are intermixed, and the role is done by the same person.
And can you just probably share some information on as to what is the career trajectory for those who take up nutrition and dietitian as a career. Like, it is a part of healthcare. It is a part of fitness. You see these kind of, professionals all around you.
Yeah.
So what is a career trajectory for, people from that kind of a background?
See, the growing trend is health. Everybody and each, I come across various persons, 1 out of 10% is on some or the other diet or some other app, working on the fitness and having a take on the nutrition and dietetics. And if you see also hospitals also, they did not, initially they did not have any nutrition, dietetics and other separate departments. Now they set it up. But in fact, the food of all the patients, like in our hospital, we have 10 hired, 10 nutrition and dietetics who will be monitoring all the food of various patients who are admitted. And huge opportunities for this are also coming up because it is not industry specific to healthcare only. A fitness industry and corporate houses, everywhere they are setting up people or setting up departments and plans, especially focusing on nutrition and health. And Government of India has also come up with a plan that to overcome the malnutrition and other aspects. So the career opportunities are very good. But in our program, what we have is food, nutrition, and dietetics. So we are also teaching them how to prepare the healthy foods also. So that is what is attracting the feminine gender, and they find it very useful. That's what they say, because it's also a very sought after course. We have 100 seats for it. We get close to 500 applications for it.
Interesting. Because that is the important part of the fitness and nutrition and dietitian, that you learn how to prepare those meals as well, and not just prescribe. So we have a student, Dhruv, who asks, can you give an approximate idea of the kind of monetary returns for someone who has a paramedical degree? What is the return of investment?
Always remember, in the Indian working sector, the couple of years they'll take you on probation. It's not your IT sector. See, don't compare yourself with the IT sector, first and foremost. So I can tell you that close to 40,000 per month would be the average in the initial trends which you can expect to earn from a biomedical degree at the upfront. Because once in 2 years you have passed on the probation period, you yourself will realize based on a quotation to jump into lakhs. So a lot of good opportunities are there in the pay package, monetary returns.
And is there something for the startup culture as well? Like, I mean, is there an avenue where people can start their own on their own? And is there something that goes on that tangent?
Yeah, see, India has now brought out the concept of Atmanirbhar Bharat. So the government is also pushing heavily towards the development of the incubation centers, and we at our university also have set up Section 8 company, which is Sparkle Cine, which is focusing on the healthcare delivery. We have a startup, I can just say you, they have brought out health foods. Just yesterday, I was having a meeting with one of the Vietnamese personnel. They want to do FDI in that company to market their products in the other countries. So startup definitely is going to catch up. So that person who has set up that company was studying food, nutrition, and dietetics. So based on that idea, he has set up that startup company. So similarly, a person was working in the area in the environmental sciences. He has set up his homemade snail-based beauty products concept. So these are some of the examples, and startup and incubation, we give very, very high prominence, and we've seen that many people are starting, and youngsters, they need a platform. And now the youngsters are bubbling with ideas, and we always support them in setting up their startups.
That's interesting, especially for someone who has an entrepreneurial bent of mind. It kind of gives a platform. We have a student called Arya who is asking, is it possible to practice in India if we have done MBBS from another country? What are the likely challenges? I'm sorry I interrupted, but she's also asking what are the challenges?
No. See, challenge is nothing. The degree should be recognized, and you should have the license to practice. You should be registered with the respective council. See, one is recognizing your degree. The second step is getting it approved by the medical council. So every state has a medical council.
Okay.
So you should get your degree recognized wherever you want to work by the medical council. Once they give the license, then only you can practice.
So it's not just central, it's state
Yeah, statewide.
as well. All
Yes.
right. Okay. Because that is something very important for students to know. And I think we just have like maybe a last question that we have the time for. We have Charushri, who has written to us saying that in your presentation you mentioned AI in medical science. What will be the practical applications of a course like this?
See, I'll just tell you an example. AI in medical sciences. You've seen your X-rays, correct? Some or the other time, you at least you would have taken an X-ray. At least you have taken some other diagnostic test, like your blood sugar levels, whatever it is, common blood test, the blood count, the shape of the cell, the RBCs, various tests you will do. You will be doing it, and you'll be learning to do. So with AI, what will happen? The moment like you take your X-ray, when the X-ray is taken, you have to wait for the doctor to turn. You've seen this, na? The technician takes it and makes the X-ray ready, but he will say, "Sir, doctor will come and he will do the report." That will be stopped. So moment X-rays come, automatically this femur bone, this is the problem. This bone, this is the minor crack. These are the aberrations which is happening. If you leave it, this may further grow into this. A chance of tumor growth is there. So everything will be automatically coming through, and it will be just certified right or not by the doctors. That is the AI level what it is going to happen. So that are the practical applications what we are looking into. And these components, when we are building this course, we are not building it alone as a university. We are going to build it with our engineering team, this program. So it will blend of engineering, and they will be training you to write down the programs of how to pick up these salient points so that you will be able to do the things very, very correctly.
Interesting. Now, a little, deviating from what discussions we are having right now. There's a question on environmental scientists. What kind of organizations or avenues do they work in?
Okay, see, environmental scientists, all the pollution control boards, they work in UN, and there are a lot of organizations like SCOPE, Society for Consciousness in Prevention or Environment. So like this, various multinational organizations are there in which they are working. In fact, what the developed nations are doing is they're doing a lot of studies on the environment, because climate is a challenge for each and every country. So their environmental scientists are playing a very, very important role.
Okay. Now, I think, the students are kind of getting active as we come close to the. So we have a couple of questions more. I'm going to squeeze them through our time. Himanshi asks, can you please tell us a little about Ayush courses and the kind of scope they offer?
See, traditional system of medicine is very, very important. Now, all the Ayush courses is Ayurveda, Unani, Siddha, and homeopathy. Now, all these courses teach you the traditional way of treating. Each and every one has a concept of treatment. Now, the routine treatment, what you learn is allopathic way of doing the things. Now, some people and the government of India, it has set up a separate ministry for Ayush, and they want to promote the Indian healthcare system across the globe. So I would think it's a very good opportunity for you to learn about it and look at the different way of treatment, because I see many elders still they don't have much belief in the allopathic system of medicine. They are very much comfortable with the traditional system of medicines. So unless youngsters learn about those, that will be lost. And in fact, there will time will come, they will not have many takers or many practitioners in this domain. So it is very important program, very well accepted. The challenges are very high, and I am seeing a lot of good employment opportunities are also happening for students who have come out through the Ayush program.
Interesting. I think we have just, let me check. Okay, there is one more. Is there a way that students can start working in the healthcare sector right after their class 10? Or maybe take up some kind of a diploma course or something like a certification and then start working?
Yeah, definitely you can. So diploma, 2-year diploma programs are there. But what will happen, I would advise you going for it. What will happen once you get into the job sector, you'll be stagnated at that level only. You work for 10 years, 20 years, then you will realize I have to do some higher degree. And our Indian education system is such that parents support your studies at least you do till graduation or post graduation also. So we are very fortunate to be in India, which is not the case in the developed nations. So don't stop at any diploma level. Definitely, you have at least a basic degree with you. That's what is my suggestion.
Correct. So the degree diploma divide still is
Yes.
still.
So
the
diploma
perception
gets you the employment. I'm not telling it will not get you the employment, but the career growth will not happen.
The perception of a degree being a
Higher
elevation is
standard.
always
Yeah,
there. Okay,
correct.
Arya has a follow-up question. Which are the countries where it is possible for a student from India to pursue MBBS? So I think she
You
is
can pursue any country.
considering outside.
Yeah,
Yeah.
you can pursue in any of the programs, any of the countries you do want to do in US, UK. So free to do.
Any countries that you would recommend, or some kind of a program which you could recommend, Dr. Vishal, for students?
See, what I would advise you is you first go to the rankings. Don't go about the country, go for university. Never have the concept of the country, go for a concept of university, which you have to change now. Because it is a global world, everything is one and the same. Go to the Times Higher Education or the QS World Rankings, shortlist the top 1000, you can get the medicine specialty based institution. And then you join any of the institution, you will not face any of the problems.
Correct.
1000 is a very big number, I feel. Yeah.
Correct. So not anymore the education destination, but more on the ranking per se.
Yeah, ranking, because it is authenticated and you will get a very high quality education. See, people are studying right from the complete East, Japan, Taiwan, and Far East regions also, right till US. Everywhere across the globe, our students are studying. We have students right from there also. Everywhere the opportunities are there.
And these courses are accepted by our country, by India?
Yeah, if they have that's what I'm telling you. Go to the NMC website. It has got the approved universities list. Check that also. Try to match with that and then do it.
Okay. That's a structured approach that one should.
Yeah, structured approach, not listening to someone. No, it's easier to get the admission. That should not be our criteria.
Correct. Okay, so now this is the last one that I'm kind of taking it. How promising are research-oriented courses and professions? For instance, in virology, pathology, how promising are these kind of career options?
See, research I'll be very upfront and honest, research has not been its due prominence in India. Everybody knows about it. But now the research trend has changed. Industries are investing huge amount of money in research. They have understood now, Indian companies, they have understood they are no longer service providers. Unless they have the unique product with them, they will not be able to survive in this world. So that's why the impetus on the research is very, very high. There are research departments set up in each and every industry. It may be smaller one or a medium, not the smaller one, the medium and higher end industries. Everyone has the research wing. So definitely a career in research is very good now. And students are not stopping there. Not at one of my students who wants, saying, sir, I want to do PDF also. And he has a passion for research and is seeing the outcomes, and till PDF you're able to also get the fellowship or the scholarship also.
Okay, so I guess this was the one last that I could squeeze through before our time got done. Thank you so much, Dr. Vishal, for your time, and it was a very insightful presentation and the conversation that you had with our students. Thank you, students, for attending and being there and hearing Dr. Vishal give us deep insight as to careers apart from MBBS. And if you have any questions, write into us. Dipanita, are you there? If we can just give out the ID on the chat, so that
I'll post
if we have, please do that. So if you have any queries that are coming to us, Dr. Vishal, we'll forward them to you so that you can let us know specific answers if there are any. Thank you so much for your time. Dipanita.
Thank you, everyone. It's nice being able to interact with you, at least virtually.
Yes, thank you so much. Dipanita, we can
Yeah, we'll
close
wrap
the,
up.
close
Yeah.
the webinar now. Thank you, Dr. Vishal. Thank you once again.
Thank you, Gauri, and your
you.
entire team at Career 360. Thank you so much.
Our pleasure. Thank you.